Welcome to Postgraduate Week webinars. This webinar is being hosted by myself, Trevor Sherwin. I'm the Associate Dean Postgraduate, so I look after all the doctoral candidates in our faculty, and that includes the PhD students and the MD students. So I guess lots of people turn up in my office wanting to know questions and or have lots of questions around the MD and what it is and how it relates to a PhD or to the other doctorates. So this webinar is aimed at trying to give you as much information in one place as possible around the MD, what it is, who can do it, and why you might want to do it. Let me just start sharing my screen for those of you who are interested. So this is the Doctor of Medicine webinar. So by all means, ask questions in the Q&A screen, and I'll try and answer them as I go along, try and make it as interactive as possible. Sorry, this isn't, it's hard to make a webinar about the Doctor of Medicine entertaining, but so it's more factual than anything, but by all means, jump in, ask questions where I'm not giving you enough information. So let's start off with basically what is a doctorate? So most people, when they think about the doctorate, think about the PhD. It's an internationally recognized degree. And so let's just define what that is to start with. So it's a research by thesis degree. And University of Auckland, basically the PhD is a minimum of 3 years and a maximum of 4 years full time. So if you want to go over the 4 years full time, you need to ask for an extension to do that. So it's a long commitment. It's a big commitment. You can study part-time. If you do it completely part-time, then that's pro rata, a 6-year minimum and an 8-year maximum. So 3 and 4 for full-time, 6 and 8 for part-time. So it's a huge commitment. And if you're planning on doing a PhD part-time as a busy doctor or a clinician or wherever, then you are signing up for many, many years. And the PhD is also aimed at prospective study. So you need to design a study, design a piece of research that you want to perform, come up with a hypothesis or the primary outcomes you want to measure. And you design a thesis proposal and get it accepted, and then perform the study over the coming years. And obviously it is a supervised doctorate, so you need somebody who's going to give you the appropriate advice and guidance over that time. And the PhD subject areas are vast as to what you can do. Obviously, not just our faculty, but many, many faculties across the university, and they all have different subject areas into which you can enroll. So that's the general sort of doctorate and the PhDs within the University of Auckland. But we also have the named doctorates, which occupy special places within different faculties. So there's a Doctor of Clinical Psychology, the Doctor of Education. So the Doctor of Clinical Psychology is D-Clin Sci. Doctor of Education is the Ed.D. You can see why that is, because you probably wouldn't want the D at the front, because then you would be at DED, which would be obviously dead. Doctor of Fine Arts, Doc FA. Doctor of Medicine, the MD, which is we're going to talk about today. Doctor of Music is a D Mus. They were thinking about having a Doctor of Composition, which I'm not sure whether they would call it a decompose, but they might, to go along with the Doctor of Education. And there's the Doctor of Musical Arts. So these are all the named doctorates that are available. And obviously this one today, the Doctor of Medicine, is where we're what we're going to talk about today, and it's particular to our faculty. It's owned by our faculty, and so you need to be registered within our faculty to study it. What is the MD not? Well, the MD is not a medical degree, and so we find ourselves, University of Auckland finds itself in a particular situation now where we have this a doctorate degree which is called the MD, but now many of our Australian universities have switched their basic medical degree to now being called the MD. So the MD, which we see as a doctoral degree, is now basically seen in Australia as being a medical degree. So there is some problems around the nomenclature and what it's called around there, but there are some adjustments in the pipeline, and we'll come to that later. And the MD, along with that sort of nomenclature problem, is that it's not uniformly recognized across the world as being equivalent to the PhD. Certainly within the New Zealand academic echelons, it's seen as equivalent to the doctorate. It is equivalent to the doctorate, but you might have to explain that. If you do an MD and you're taking it abroad and you want to use it as your major qualification elsewhere, then you'll need to explain that it is a doctorate by research as opposed to a medical degree or other. So what is the MD itself? Well, it is a research thesis degree. So basically it is by research. You do have to write a thesis, and it's that thesis which will be examined to be able to be awarded the degree. It is equivalent in scope and standard to the PhD. That's absolutely of the importance these days. The MD, prior to the sort of 2016 statute, was seen as a sort of outlier, which maybe wasn't equivalent to the PhD, but then it was brought very much into line with the scope of the PhD and the expectations of the PhD. So it is equivalent in scope and standard to the PhD. And so if you're going to think of doing an MD or supervising an MD, then that's where you need to be heading. And of course, the MD became a supervised degree. So prior to that, the old statute, it was an unsupervised degree. So people could enroll and basically write up their own research unsupervised and submit those theses. But of course, those people enrolling in that weren't necessarily very well versed in what a thesis should look like or how it should be structured or wherever. So the standard, you can see, was probably a little lower than the PhD prior to that, but now it's a supervised degree. So you need to be, if you're thinking of doing an MD, then you need to be supervised, and if you're thinking of supervising the degree, then you need to have a doctorate to do that. As I say, it's owned by the Faculty of Medical and Health Sciences, but it is not owned by the School of Medicine. So the MD belongs to the faculty, so you can study, a student can study the MD with any one of the schools within the faculty with an appropriate subject area from wherever. So you could choose to study in medical sciences, in medicine, or even in pharmacy, or any other school that you decided you wanted to major in. So it's not limited to just being registered within the School of Medicine. So again, because the scope is quite broad, you can do a clinical research degree, you can do a biomedical, a laboratory, or a mixture of those subject areas. And as I say, it's registrable in any of the Faculty of Medical and Health Sciences schools. You have to be registered within our faculty, but you can be registered within any school. Who's eligible to do it? Well, of course, that's where the peculiarities come in. It's like many people can register for a PhD, but only medical graduates can register for the MD. So you need an MBCHB from University of Auckland, or from another university with equivalence to the MBCHB, the Bachelor of Medicine, Bachelor of Surgery from the University of Auckland. So basically a medical degree from an equivalent university would allow you to register for the MD. And you need to have, similar to the PhD regulations, admission regulations, is that you need to have shown the ability to do research. What does that mean? Well, it means it can be quite variable. The School of Graduate Studies see it in very black and white. The ability to do research, they say, is having done 30 points of transcripted research somewhere within your education, your tertiary education. So, you know, they do accept 30 points from maybe a PG DIP or something like that, but ideally you should have 30 points from a master's or an honours. But in the medical degree now, there is the ability to do a 30-point research component in year 6. If you didn't do the honours previously, you can do that research component, which is a 30-point 10,000 word dissertation research, which also counts towards that ability to do research. If you don't have 30 points of transcripted research, then we start looking around in the CV of the person who wants to enroll to see if we can find something like some piece of written work, either a published paper or a series of case reports that you did for your college exams, or something that can be assessed by a member of the university and who knows the sort of standard at the University of Auckland, and say, look, this is equivalent to 30 points of research, of a research component at the University of Auckland, and it would have scored a B+ or better. So that sort of ability to do research is a kind of a fudge factor, and they're just trying to ensure that people are being set up to succeed rather than set up to fail if they haven't done any research prior to doing a doctorate. The current MD regulations say you need to be 5 years out from graduation, from your initial medical graduation. However, again, there is a little bit of leeway around that situation, in that we have been allowed to register students who didn't quite have 5 years experience out from their initial qualification, but would be 5 years out by the time they submitted their thesis. So there is a little bit of leeway around that. So if you're at all unsure about that, come and have a chat to me. But this rule also, we are hoping to change in the new MD statute, which will come into force next year, and I'll tell you a bit more about that in a short while. So why would you do an MD rather than a PhD? It's quite simple, really. The MD is a unique degree. Even amongst the other named doctorates, it is a quite unique degree, and it has a very large amount of flexibility. When I talk to some of the other associate deans in the other faculties as to why we have this flexibility around the MD, they are quite envious that we have this degree with such flexibility when their named doctorate does not have the same flexibility. I don't know how we managed to get it through. It was done way before my time, but the fact is that we now have this degree on our books which has a high degree of flexibility. And what are those degrees of flexibility? Well, basically, it's the only doctorate in the University of Auckland which allows you to include retrospective data. So at the beginning, I told you the PhD was a prospective degree. So you need to plan what study you're going to do, enroll, and then start your research. You cannot, in the PhD, include data which is done prior to enrollment. That is not the case for the MD. The MD, absolutely, you can include retrospective data. And that includes, if you're doing a thesis with publication, that includes previously published papers. So it really does have a high degree of flexibility in the inclusion of data. So that includes students who may be doing some, or doctors who are doing some research and then suddenly find they've got really quite a large volume of research that they've accrued, and then they think, oh, why didn't I register to do a doctorate before I started this? Well, the MD allows you to sort of retrospectively do that. And if you find you're accruing enough data to write a thesis, then the possibility is still there for you. And the MD, because the ability to include retrospective data has a minimum time. You remember I was previously telling you that the PhD is minimum 3 years, full-time equivalent. The minimum time for MD submission is 12 months. And as I say, even some of that, we can sometimes get that retrospectively adjusted as well. Within the same calendar year, we can often ask for a 6-month retrospective enrollment. You know, the student was doing this work, didn't think about doing a doctoral degree, but now has accrued quite a bit of work, and you know, we're in July of 2020, or and we think the student would now like to enroll in the MD. Can we backdate that to January 2020? And therefore their minimum submission time would be at the end of December 2020. So you can see it actually allows your student to enroll quite quickly and write up the data that they've got and submit in a very short time frame, a minimum of 12 months. In order to do that, we need to ask the Dean of Graduate Studies for permission to do so, which we've done on many occasions, and it has never been turned down. It's not in the university's interest to make a student hang around with a thesis which is almost complete and say, no, you can't submit early, even though you've completed your thesis. So as long as we put up a good argument for that, that has never been turned down. So that minimum 12-month full-time submission is really quite unique, again, within the university, as is the retrospective data inclusion. So it does allow a high degree of flexibility for people to complete the MD. And as I say, if you're using thesis with publication, there is no reason why you cannot include those publications in your thesis. A couple of caveats around that is that this is not a thesis by publication, which some of you may have come across in other universities, where you simply bind your published papers together and say, look, this is worthy of a thesis, and you submit that. That is not what the thesis with publication appears as. The thesis with publication has to be a coherent body of work which hangs together as a progression and a series of investigations towards an endpoint. It needs to be written as a thesis, so that you may need to do some modifications of the publications to make them readable as a series of investigations with a coherent theme passing through them. But you can, and I supervised a student last year, and I think 2019, who was a very bright young doctor who had 20 papers that they had published in their area of expertise, which were easily formed a coherent body of work, and they just wanted some guidance as to how to put that together into a thesis. So I ended up supervising the student just purely on how to write a thesis, basically, because the work was already done. The research work was already done. So it is a very, very flexible degree, and a high, I hope it is quite attractive because of that. So one of the aims of this webinar is to put out to you the reasons why you might want to do an MD, or why you might advise one of your students or registrars or fellows to do the MD. Is that it really is quite a reasonable amount of flexibility. Just to follow up on that, there is a lot of flexibility on how much you can do your clinical work at the same time as doing an MD. We have to be careful in how we put this together, but if you have a young clinician you are supervising, or who is doing significant amounts of clinical work, but in the same time as they're doing their clinical work, they are gathering the research data, i.e. the research and their clinical work are so intertwined that they're inseparable, it is possible to be a full-time clinician and be registered for the MD at the same time as a full-time student. That is possible, with the expectation, though, that you will advance the thesis significantly as a full-time registered student. So if you want some more advice around that, I'm happy to meet people individually and advise on how best to go around that, and whether the student is better off being full-time registered or part-time registered. And the other thing about the MD at the moment is that there's no mandatory oral examination. So if the thesis is submitted, it gets examined as a written thesis, and the commentary comes back from the examiners. And if all is well with the thesis, then usually the thesis gets recommended for minor corrections or revisions or whatever, subject to the examiner's comments, but no oral examination is necessary at the moment. However, next year that is highly likely to change. So you could register this year under the old regulations if you are particularly squeamish about an oral examination. So if you're looking at the MD and the PhD and their equivalents, they are both recognised doctorates. They allow you to perform all of the duties at the University of Auckland that you need a research doctorate to do. It's not seen as separate from a PhD. It's not seen as inferior to a PhD. You will be allowed to supervise doctoral students. You will be allowed to supervise PhD students with an MD. It's seen as equivalent. And there are several of our senior academics within the medical faculty who are supervising students who have MDs, and you would never guess that they are any different from a PhD. In fact, you would. Some of them have higher doctorates, which they've moved on to. MDs are also eligible for the VC's prize, so the university sees them as equivalent, the VC sees them as equivalent, so you can be up for those prizes by doing an MD. And as I say, it does allow for the supervision of doctoral students. So everything you need a PhD to do, if you're planning an academic and a PhD as a sort of step forward for your academic career, the MD allows you to do that as well. So by all means, look at the MD carefully as an option for yourselves. It's not generally necessary to do a PhD if you are a clinically qualified medic who is looking to fit a doctorate into your busy schedule. As I say, there are changes afoot. So the MD doctorate was reviewed. Actually, it was reviewed 2019, and we're just going through the regulations now as to the recommendations from that review, which will see some major changes around the MD. But specifically, those changes do not relate to the flexibility around the degree. Those have been very much retained by the review board, who saw them as great strengths of the MD, that the short submission timeframe, the retrospective data, etc., was seen as great strengths and to be retained. Where it will change is that we're planning to remove that 5-year experience regulation, so that you will not need to be 5 years out from your from your medical graduation anymore. We couldn't see a point for that. We couldn't see why that was originally included in the regulations, of why you would particularly need 5 years experience to be able to enroll for an MD. So that is going to be removed. The oral examination will become mandatory in the new. So that was the one thing which was seen as possibly not being equivalent to the PhD, and therefore it was seen by the review panel as needing to be reintroduced, that the oral examination. So the MD students, similar to the PhD students, should be seen as, once their thesis has been examined by the examiners in written form, they should proceed to an oral examination. And also the name is highly likely to change. As we've discussed, that the MD is now the basic medical degree in Australia. So we're looking at a change of name for the MD. That has not been decided what it's going to be yet, but it's highly likely to be along the lines of Doctor of Medical Research or MD research. Yet to be decided, but will be more explicit around the fact that it is a research doctorate rather than a medical degree. So I thought I would just end. I haven't got any questions in my Q&A, but I presume maybe I'm answering people's thoughts as they come on. But I thought I would just end with a couple of case scenarios. So as to when I have come across people doing MDs. And I've seen people as a young doctor who have finished sort of PG postgraduate year 1 and in year 2, sort of house officer years, maybe done a bit of non-vocational registrar training, and they're looking and they need some sort of research component necessary for the vocational college training. Certainly in my field of ophthalmology, that's true, that the students need to show an evidence-based medicine research approach. And so we often get our students who are people who are looking to get on the registrar training coming and doing research with us as a junior research fellow, and they often register as an MD during that time, so they can get something really constructive out of their research time rather than just a couple of papers or whatever. So it suits the young doctors who are trying to get on registrar training. Case scenario 2, we have a mid-career doctor who maybe hasn't been involved in academia prior, but has several publications in a research area, and they suddenly find themselves becoming really quite expert in a certain subject area and having published several papers in the research area, and think they have a sort of thematic component to them, or maybe they're looking at an academic post within the University of Auckland or similar to that, and thinking, well, why don't I write up the research that I've got so far, and that will enable me to supervise doctoral students if I take up this academic post, or if I take up this honorary post, then I can supervise doctoral students. So mid-career doctors often look back and think, oh, maybe I should have done something more concrete with these research papers that I've gathered together, and I've become quite unique in my area, and maybe I should be able to write this as a thesis. Case scenario 3, this is rare but does happen, is that we find people who are sort of who've been medics all their lives and then decide to retire, and then kind of miss the challenge of maybe doing surgery anymore, or the regular clinics or whatever, and find themselves with time on their hands and think, oh, maybe, it's time I did something more academic, and maybe that doctorate I thought about doing when I was a young gun and didn't quite get round to, maybe I can do that now. And particularly if they've got, again, a history of research publication, because of the flexibility in the MD, that's perfectly manageable. Bringing it together, looking for some sort of intellectual stimulation. Now they've got some time on their hands. They don't want to commit to 4 years for a PhD. We had one particularly elderly doctor, retired for many years, who was 88 when he registered for his MD, and one of the things he he said at the beginning of his MD was that he hoped to make it through and finish it before he corked his clogs. So for many reasons, people may not want to commit to 4 years of study, and you can, with an MD, you can commit to a single year, helps you get through, and can be something that maybe semi-retired or fully retired doctors might want to look at. Case scenario 4, I just wanted to introduce as a potential for these troubled times that we live in, is that any sort of early career doctors, registrars who have had their plans disrupted over this sort of COVID period and may have been researching for the past while and, with some of the senior clinicians and gathering some expertise in certain areas, and maybe who are now not able to go on their overseas fellowships or the other research and study leave that they had planned or whatever, then it may well be that we should encourage these students to get something constructive out of this time when we're all being constrained to New Zealand and not being able to do something overseas. That maybe these young guns could look at writing up some of the research, putting together a thesis. And don't forget, it's the MD doesn't have to be prospective and it doesn't have to be retrospective. It can be a mixture of both. So if you think you have a series of papers which hang together in a certain area, but you think, oh, it's not enough for a thesis, that's fine. You just then need to put together, okay, well, what work do I need to do following on from those papers to then put together a thesis which is worthy of a doctorate? So you may well plan to do a year or 2 years research on top of what you've already got, to then bring that up to a doctorate standard. So you can do a mix and match of what you've already published and what you intend to research. And if you're doing a thesis with publication, a thesis with publication allows you to put together published work alongside unpublished work. So it doesn't all have to reach publication. You can write it together, as long as it's explicit as to what has been published and what hasn't. You can write it together into a coherent thesis, which is a single examinable thesis. So that's all from me. I hope it's been informative. I hope I've given you some of the taste of what an MD is, why we have an MD on our books, which is remains there separate to a PhD, and why it might be attractive to our medical graduates as to wanting to pursue an MD. If you have any further questions, no questions have appeared in my question and answer box, so either no one's listening or I must have answered your queries. But by all means, if you go away and you think about these things and you have more questions and you'd like to come along and talk to me about it, or just, if you want some advice on how to supervise or how to find a supervisor or whatever, please feel free. I'm just, as my sort of name suggests, t.sherwin@auckland.ac.nz. Drop me a line and we can arrange a time to talk. So I will finish there, and presuming that we have, if we have no more questions to answer, then we will end the session there.